All right. Well, it looks like we're recording and I have 2:30 Eastern time, so we will go ahead and get started. Good afternoon or morning, everyone. Welcome back to SAN's Summer Webinar Series. This series was designed to bring together colleagues from across higher education, regulatory agencies, accrediting organizations, and professional practice spaces to explore some of the most timely and complex compliance issues institutions are navigating today. Throughout the series, we're looking at areas where compliance responsibilities increasingly intersect across higher education, whether that's financial aid, professional licensure, accreditation, disclosures, or other institutional operations. Today's session focuses on professional licensure and, more specifically, the role educational requirements play in licensure portability and workforce mobility. Across professions and jurisdictions, we see different approaches to determining whether applicants have met educational requirements for licensure. In some cases, boards recognize graduation from an accredited program as sufficient evidence that educational requirements have been met. In others, additional individualized curriculum review may still occur. Today's discussion is intended to explore how those systems currently function, where institutions and boards experience complexity, and how accreditation-based recognition is already being used in some contexts to support efficient review processes while maintaining important public protection responsibilities. I'm Katherine Kerensky. I'm the Director of Digital Learning, Policy, and Compliance with SAN, and I'll be moderating today's session. We're very excited to have a terrific group of panelists joining us for this conversation today. So I'd like to ask if you all could please introduce yourselves, say a little bit more about you and what you do and where you're from. And Chris, we'll start with you.
All right, great. Thanks, Catherine. Hi, everyone. I'm Chris Mall. I'm one of the co-founders of Higher Education Licensure Pros. We work with colleges and universities around the country to help support your licensure compliance processes in research in particular. So we have something called the bookmark, which I think some of our members are on today, but that helps fill that need with licensure research. I'll leave it at that.
Thanks, Chris. And Emily, how about you introduce yourself next?
All right, thanks. Hi, everyone. I'm Dr. Emily Bogus, and I am also with Higher Ed Licensure Pros, and I am the Director of Educator Licensure Research. So I focus mostly on educator preparation and licensure.
Perfect, thank you. Sarah, how about you go next?
I'm Sarah Cheverton with James Madison University in Virginia, and I am the State Authorization Compliance Officer here at the university. And so sort of the on the ground, boots on the ground person.
Awesome. Thank you, Sarah. And last but not least, Sam, if you could introduce yourself.
Hi, I'm Sam Sands. I am the executive director of the Minnesota Board of Psychology, and I've been the executive director for about 9 years now. And prior to that, I was with Walden University and Capella University.
Thank you all, and thank you all for being here. If we can go to the next slide for just a moment. So as we go through today's discussion, we encourage you all to use the chat feature to chat amongst yourselves, share information with each other, and more. If you have questions for our guest panelists, please use the Q&A feature of Zoom so we can keep track of questions. We already planned to cover questions that were submitted via registration, but we welcome more questions, which we'll take primarily at the end or as needed throughout the session, so put those in at any time. If there are any questions remaining that we're unable to get to, we'll send out responses to everyone who registered. This session's also being recorded, and everyone who registered will receive the recording via email. So this session is primarily a panel discussion, so we will go ahead and get started. And to start, we wanted to start by grounding ourselves in what the current landscape is from both the institutional perspective and the licensing board's perspective, so that we have a kind of shared understanding of the systems that institutions, regulators, and licensure applicants are all navigating today. So Chris, I'd love to start with you at a high level. When many people hear professional licensure, they often think of about a board issuing a license after our graduation. For people who may not work in this space every day, the complexity can sometimes be invisible or at least less noticeable. But institutions are interacting with licensure requirements much earlier in the process when recruiting students, designing programs, placing students in placements, and advising them throughout their education. So could you share from your perspective what does the licensure landscape look like today compared to 5 or 10 years ago?
Yeah, I think this is a great question to consider, especially as you just referenced, Catherine. Many of us are now paying much closer attention to licensing in general and how that's impacting our programs at our institutions. And from my perspective, I have seen some pretty significant shifts over the past decade. So we have new license types emerging every year. And so some examples that are somewhat well known now are like behavioral analysts or music therapist. Sam's nodding because he also gets to regulate behavior analysts in Minnesota now. But just every time a new license is created, think about that kind of expanding responsibilities, both with the licensing board or agency, and then obviously trickling down to institutions and the work that we're all doing. Not to mention the actual impact on those professionals who are trying to practice or work in that space. So in that way, I guess there's been kind of a shift towards more regulation and expanding regulation. But on the other hand, I will say there have been significant shifts in trying to create more streamlined processes for license mobility. So I know we're going to talk a bit later about compacts and reciprocity agreements, but I think that's another important trend over the past decade to keep in mind is just the creation of new licensing compacts and new mechanisms to try to make that mobility for licensed professionals a bit easier throughout the country. And obviously, the rise of virtual services, people practicing things across state lines online has really, I think, helped accelerate that mobility piece.
Hmm. I think also one of the things that, might be surprising in addition to all these, changes that have occurred over the last, 5 to 10 years is just how many moving pieces there are. So from your experience, in working at institutions and with institutions, what tends to surprise people outside of this work about how complex it actually is?
Yeah, I think the outside of this work is the important part to this question here, because those of us on here know if you're in this work, you know how complex it is. But I think there are some common kind of misperceptions out there around licensing. One of the big ones is, well, there's a national licensing exam for the profession. And so that means, anybody who can take that exam is going to qualify for a license in every state. Well, that's generally not true. The exam's a very important piece, don't get me wrong, and obviously important for students to be able to sit for an exam, but that's not the end all be all to this work. I think for people outside of this world, they also don't really fully understand that because states get to regulate licensure, they get to decide which professions and occupations they're going to regulate, how they're going to do that, what the educational requirements are, what the other requirements are. People don't understand just kind of the vast differences that exist from state to state within each of these professions or occupations that are licensed, and they falsely believe that there's a lot more uniformity than there is. And even when we get to states that do utilize accreditation, programmatic or specialized accreditation, which I know we're going to talk about in a bit, there are instances where they'll recognize that accreditation in part, but they still have their own, unique content subject areas that they want to see on a transcript. So the complexity, again, as you all know, is pretty widespread, and I think is unfortunately in some ways just getting more complex, especially when we layer in our responsibilities under the Title IV regulations and SARA policy.
Thank you for that, Chris. And I think a theme that we'll return to throughout, today's discussion is that, um, there's not really one single standard that institutions are evaluating against. There's often dozens of jurisdiction or state-specific requirements that have to be evaluated simultaneously. One thing that Sarah, I think this might be a good place to, bring in some of the survey findings and the operational realities that institutions are reporting. And Amanda, if you want to put the survey report link in the chat. And for a bit of context, about a year ago, to help us better understand how these challenges are playing out in practice, SAN conducted a survey examining how institutions are experiencing professional licensure compliance on the ground. So, are on the ground. At its core, the survey sought to answer, where is the workload showing up? how are institutions managing these responsibilities, and then what are the impacts or decisions that are emerging as a result. And we were very fortunate to work with Sarah on both the survey design and analysis. So Sarah, if you can share, what did the survey tell us about the institutional workload that's associated with professional licensure compliance?
Okay, well, because we had some charts available, I thought I would share that in answering this question. So, as you can see, if you take a little look and really just look at the bullet items, 86% of the respondents reported a moderate or significant increase in workload after enactment of the 2024 certification procedures, and only slightly more than 6% reported none or very little increase. However, despite this extra work, there were less than a quarter of the respondents. This stat is not listed here, but there are only 22% of the respondents who hired additional staff. Let me go back here. But of course, we suspected that interpretations of moderate and significant might vary. And so we asked them to estimate the number of hours their work increased. And then we kind of looked at those two things together to understand what people really meant. We found that while one institution described only a few hours of additional work as significant, another institution described the same number of additional hours as moderate or even minimal. For example, some institutions reported a significant impact, but estimated an average of fewer than 3 hours of additional work per week, while others considered 21 or more hours a moderate increase. What might account for those differences? The data suggests that to some extent the type and size of the institution, the number of licensure programs, and maybe more importantly, the degree to which the work is distributed across the institution influence the perception of the additional work. But there was overall a perception of additional work. For some, at least, the work is what one respondent called an undue burden. And as they commented here, we thought this was such an important comment that we have been including this when we're talking about the report. 4 to 6 hours doesn't sound like a lot, but 50 states plus territories and multiple programs, it's a lot for one person. All of these requirements are burdensome. No public institution, and I would add probably no private either, want to harm students. There has to be a better way. So these are some things that we paid attention to, and I think that it creates, it helps us to understand a little bit better about what folks are dealing with.
I agree. The data really helped quantify the challenge, especially in what you just shared. But we also, in between analyzing the data, talking with institutions, it also helped us understand where institutions are spending their time. So based on the survey findings and your own experience, if you want to share, could you share how institutions are actually managing the ongoing work of tracking and researching and interpreting changing requirements?
Yeah, I sort of think about that as two separate tasks of managing sort of the research and the tracking of requirements, and then of actually interpreting the requirements. But they both require some level of knowledge and understanding of how first to scour state regulations and codes to find the requirements, and then to understand what they mean for your institution. Both tasks are time intensive, although in my opinion, researching and tracking the requirements requires much more time than interpreting them. That may depend on the program and your situation. Both tasks can be performed within the institution, although we've learned that interpreting what the requirements mean for your program is best done by the state licensing board. And I would say it like this: the best assurance for your program, that best assurance that it is in compliance with the state's requirements, is to obtain confirmation from the board. So how do institutions do all of this? As expected, we found a lot of variation across the institutions. Most institutions rely on their own staff and academic departments to do it all: research, track, and interpret the requirements. There's some that do sort of a mix. Smaller institutions with fewer staff and resources are more likely to manage with one or two people, some of who kind of work this into their current role, and who also tend to use manual processes. Larger, well-resourced institutions might have more dedicated staff, even including legal staff, to conduct the research, to track requirements, and interpret the results. And some have tech talent to help develop automation tools. A much smaller percentage of institutions look to outside resources for help with one or both of those tasks. And as I mentioned a moment ago, obtaining confirmation from a state licensing board is the best assurance that your program meets the requirements. It doesn't mean that you're not still having to do a lot of work, but at least you're putting the onus of that interpretation on the experts. However, only 7% of the responding institutions indicated that they actually obtain this approval. It's not because they don't want to, it's because there are multiple barriers to taking this approach, which we're not going to talk about right now, but there are multiple things that make that challenging. And some institutions also have funds to subscribe to services that actually do the tracking and the research. And so, Chris, I'm going to turn this over to you, and curious about your thoughts about that.
Yeah. So just piggybacking off of that, Sarah, I mentioned before, but at HELP, we do support in particular the research function, the research portion of this work. And so we have institutions that rely on our database called the Bookmark, where we have a team of researchers that look into state law, as well as information available publicly on the board's website and other third-party sources, and compile all of that into a resource. And so we know that we are happy to report that we save our members quite a bit of time with that research portion of this compliance work. I think just adding a bit on to what Sarah was saying, in our experience, again, we work with colleges and universities of all types and sizes from all around the country. And it really is very different how different institutions are approaching their overall process and management of this work, both the research piece and then comparing your own programs and making those decisions. And so there's not kind of one right size approach to this. It really depends on a number of factors, staff and faculty availability, IT support and resources, how many licensure programs even, right, is often a big driver for this, or the types of licensure programs. And those all kind of come into play when setting up the right kind of systems and processes to manage this work.
That's perfect. Thank you all so much for sharing there. And, we've talked about institutional processes, compliance responsibilities, operational complexity, but ultimately institutions aren't navigating these requirements in a vacuum. As we're kind of implying, these decisions that institutions make and the differences that exist across institutions have real implications for students and graduates as they move toward employment and professional practice. So, Emily, I'd love to bring you into the conversation here. One of an assumptions that some might make that could accompany online education, and an increasingly mobile workforce is that geographic flexibility naturally translates into professional flexibility. But in reality, licensure requirements can create a different experience for graduates. So, from your experience, especially with educator programs, how would you say that kind of compares with what graduates actually encounter when educational and licensure requirements vary across states?
Yeah, thanks. I'm actually really excited to answer this question because I mean, what we do is for students, right? So it's always important to keep their experience and their goals in mind. Um, and like you said, in today's world with remote work and the mobile workforce, it feels like geography shouldn't be a barrier, but it really is. Chris said that there's very little uniformity across states, so that kind of creates a patchwork of licensure requirements in our nation. And so, a graduate will have completed an accredited program. They've gone through all the coursework requirements, they've done their clinicals, they passed an exam, sometimes even gotten a license in one state and then they move to a new state, even if it's, a border state, and they face a mismatch. Maybe there's different courses that they need to complete or clinicals, exams are very common. Um, and in some cases, they can get a temporary license that will allow them to begin working in their field, but they would still have additional things to complete that, it costs money and time. And so in some cases, it can feel like starting over. And there's a lot of anecdotal evidence out there from graduates in these situations. And I'll give you two examples. So for our military spouses, that is a highly mobile population, and they face these barriers a lot. And so the Department of Defense has initiated a few compacts like the Interstate Teacher Mobility Compact, because these military spouses were getting pushed out of the workforce because they were unable to get a license. And then another really interesting study was done by Dan Goldhaber and his group in 2015 and in 2019. And they looked at teachers on the Western states on how they move. And they found that teachers are more likely, actually three times more likely to make a long distance move in one state than a short move across the border. And it's not just licensure requirements that play into that, um, but it's a factor. And so, these licensure barriers can slow careers, they can push people out entirely, because there's so many different requirements everywhere.
Thank you for sharing that. And I think that's a good point. You gave the example of the military student, and that not every student will necessarily experiencing these challenges, in the same way. And Chris, I'd love to get your perspective on if there's any other, student populations that tend to be most affected by, some of these mobility challenges or other delays or differing educational requirements.
Yeah, so I'm not aware of any broad studies that have looked across professions at this. If anyone else knows of any, please put it in the chat. I'd love to see that. But I think again, just kind of speaking anecdotally, having worked with institutions around the country and worked for a large online institution myself, I think we definitely see a large impact to kind of those, quote unquote, untraditional or non-traditional student population that maybe are trying to juggle finishing a degree and work and families and all of these other things. And so, not that licensure is on top of mind for any of our students, to be honest, right? But I think when you have a student who has a lot of other responsibilities in their life, understanding licensure and what the application process is after they graduate, what those additional steps are, is even further lost in the shuffle. And so they can be met with those delays, right? Having to do something that they weren't expecting to do. And it just further pushes out that timeline for licensure, in addition to other kind of more mobile populations. So military affiliated is a great one, but there's other kinds of groups that tend to be more mobile, so willing to move for job opportunities, or their family or spouses in that bucket. And so that kind of causes these unnecessary delays when they've completed a program in another state, even been ready for all of those additional process steps for licensure, but then are actually in a new state. And I'm wondering, Sam, if you want to add anything here from your own experience of those kind of applicants that come to you at your state board, if there's kind of a specific group or type that fit into that.
So that's a great question. I guess from my perspective, and I'm only speaking for, the Board of Psychology here, because all the different professions kind of have differing levels of regulation and differing levels of how far they drill down on educational programs of an individual that an individual completes. I think the most affected people are people who had plans to live in one place and then end up living in another place, right? They thought they were going to try and meet California's requirements if they're even thinking about licensing at all. And then something happens. Their partner gets a job in Minnesota, or um, they get a job opportunity in Minnesota. And so they move here. And now they're looking at maybe pretty different requirements for licensing in Minnesota instead of what they might be looking at in California, for instance, in this example. Um, and so I think that those are the people that we see the most that it kind of impacts them and delays them a bit in their licensing.
That's great. And I think what I heard from both of you, which is a really good point, is that, the students in these programs, have so many other things they're considering and, licensure and how that's impacted by, changing programs, changing states, is not really top of mind. And so I think that does, kind of propose a challenge for institutions where they're trying to strike a balance. And it's very important to be very transparent about these licensure realities, but also not discourage students from pursuing their educational goals.
Mhm.
And so, Sarah, I was wondering if you have any thoughts or anyone who might want to share, how do you think institutions can balance communicating these types of realities to students while still supporting access and opportunity for them?
Yeah, I'd be very interested to hear what other people think about this. My first thought was to remind myself that, it is right to be transparent, and about, the opportunities, but also the limitations associated with a particular program. It's just the right thing to do. Um, but I worry that the public and direct disclosures, especially now with the limited language of meets requirements and doesn't meet requirements, that can unnecessarily kind of limit the prospective students, I don't know, imagination about what is possible and leaves them confused about what steps they need to take. I think also the requirement to consider additional state rules, such as program accreditation. I mean, not that they have to, but the fact that we have to, and that goes into the decision that they may not understand or even see, enclosure laws and all those kind of things. The fact that those add to our determination, I think, just adds to the potential for confusion. And I don't know if this is true. Be curious to know if other people think this, but my thought is that it's particularly worrisome for prospective students who get a direct disclosure because, like they've applied and all that, and then they get this direct disclosure that has legal language and so on. So what I was thinking is that to help mitigate some of the confusion in both the public and direct disclosures and to help support the prospective students, what I saw in some of the report results and what I've observed otherwise is that some institutions are very clear and concise in their explanations of the meaning of doesn't meet, for a particular program in a particular state. Sometimes they're long and sometimes they're legal, which I worry about that too. But I think that the effort made to help students or prospective students understand this is really important. For direct disclosures, some institutions try to have conversation with the prospective student. There was one school I talked to, and they said every single one they talked to, and I was so impressed by that. And if appropriate, to then offer them the opportunity to submit the student self-attestation. I wonder, while there are many institutions that probably have too many students, too many prospective students to implement that approach, I really see in other institutions and with our own that when you can have that conversation with a student, that even if they end up not being able to attend your institution, you have helped them along the way. So I'm curious what other folks think about that. How else can we do that?
Yeah, I'll just add to that. I think, Sarah, like that idea of education about licensure, like incorporating that into existing processes, during admission or enrollment, but even after that. So I'm thinking back to my days when I worked for Capella University. We actually implemented assignments into many of our licensure program courses that students would have to complete. And part of the assignment, and was making sure that they knew in real practical steps what their process was going to be to apply for a license in the state or states that they were planning to do that after they graduate. So again, not always possible to implement this in every licensure program everywhere, but you can look for opportunities like that. So we're not just talking about meeting these kind of bare minimum, disclosure requirements that we have under Title IV and SARA policy, but how can you also implement some things that are going to help raise awareness, educate your students and graduates, and really set them up for better success when the time comes that they're graduating or completing the program and making that license application.
Can I just say one thing about what you just said, Chris, if that's okay? Is also encourages those students to have ownership in their licensure. I mean, because licensing boards aren't evaluating institutions. I mean, we're evaluating the education that this individual receives. So we look at the degree and in some instances the coursework, and we're evaluating that, and it's on the applicant to demonstrate that they meet requirements. And so any opportunity that you can encourage them to take ownership in in moving their licensing process forward in terms of understanding, I think is worthwhile for what the expectation is.
I think that's a great point, and I think it segues nicely into getting a little bit more of the perspective because we've talked about the complexity from the institutional side and the impact on students. And I think before moving into approaches to improving portability with accreditation, it's also just important to understand why these requirements exist and the role that boards play.
Mhm.
So obviously, licensing boards are charged with protecting the public and ensuring that individuals are entering regulated professions with the qualifications. Um, so, when institutions look at licensure requirements, they're focused on the specific coursework, credit hours, educational standards. But from your perspective, I'm sure those requirements exist to serve a broader purpose. So, could you share that when, your board is reviewing the educational preparation for licensure, what are you ultimately trying to determine and how does that purpose shape the way that educational requirements are defined?
Yeah, that's a great question. So first, I just want to say for the Minnesota Board of Psychology, we have a mission. Our mission is to protect the public through licensure, education, and regulation to promote access to safe, competent, and ethical psychological services. So everything that we do, we try and tie back to that mission. Um, so you might think, well, what does that mean in terms of like how we do our day-to-day work? And um, one thing about professional licensing is defining what the scope of those practices are and how they do that, how the professionals do that is by doing a job task analysis. And so they survey all psychologists in my instance, and I'll just deal
Yes, hi.
particularly
I
in psychology
just got
here.
a new
Um,
gas water heater
they
and
do a job
schedule an
task
inspection.
analysis about what work those people are actually doing, and then they develop the testing based on the types of work. And that's basically to determine the essential knowledge, skills, and responsibilities required for competent practice of that profession. Um, and so then the way that it sort of breaks down is we look at what that kind of expectation is, and then as a board, we decide how are we going to evaluate somebody who has a degree to make sure that they have the education, training, and can pass the licensing exam that demonstrates that we believe that they can provide these services that are required of an entry-level professional. And so licensing is always a three-legged stool. It's it's the education, which is the portion that you all provide for the applicants. It's the experience usually, which is either in their program or in psychology, it would be an internship in the program, and then also a postdoctoral experience, and then also the testing to make sure that they have the knowledge, or in some professions, it's a competency exam that they have the competencies that they can demonstrate those um, to that they can demonstrate those that they're competent to provide those services in Minnesota. Um, and so I think that really what we're trying to do is make sure that people are actually competent to begin practicing at the independent level. Because remember, all the education is leading up to them working without somebody looking over their shoulder part of the time. And because of the other parts of the mission, there's the licensure, but then there's also the education and the regulation. A lot of my board's job falls to making sure that there's not competency drift for those individuals, making sure that if they start out competent, that 10 years, 15 years down the road, they still are practicing at a competent level. And that if somebody says, hey, I've been wronged by this psychologist, that we'll investigate that and see, do we think that maybe this person has had some competency drift and they need some remediation? And so, in order to look at that, however many years down the road, we need to have confidence that when we license them, that they're competent to practice. And so we use these three different kind of tools to make sure that, you know, that the state feels comfortable with them seeing some of the state's most vulnerable individuals. Because really,
Mhm.
this is about protecting those people who are receiving, in this instance, psychological services, often one-on-one with a psychologist. And we need to feel comfortable that the person sitting in the opposite side of that chair that are providing that services are going to do it along the lines of what we would expect them to do it in the state.
That's wonderful. I think sharing that context is really helpful. And I think that, there are many, of our institutional stakeholders who, may not have too many opportunities to interact directly with licensing boards and,
Mhm.
may not always have some of this context or visibility into the regulatory environments that boards operate within or just the kind of purpose behind things. So, before getting into, more specific on, how you use accreditation as a recognition tool, are there any other context about like board responsibilities or regulatory expectations or other processes that you think it's important for institutions to understand?
Well, it's interesting. One thing that I heard was that maybe, a lot of institutions aren't contacting the boards, or maybe they do contact the boards and they don't get a straight answer from the boards. Um, and I mean, I think that that's true. And I think by nature, boards, including myself, in my agency, we strongly believe we evaluate the applicant. The person who is providing the credential is the person that we're looking at. It's not We're creatures of statutory creation as an executive branch agency of government. If you look at the statutes related to the Minnesota Board of Psychology or any of the boards in Minnesota, any of the health licensing boards in Minnesota, you're not going to see really anywhere in there a statutory authorization for us to review and approve an educational institution or a program. We just don't give carte blanche to programs, even those that might be the tier one research land grant university here in the state. Don't get a blanket approval that all of their graduates get licensed. They might get that through the specialized accreditations that their programs hold to get to that next conversation, but it's not like anybody who graduates from the University of St. Thomas as a local program would automatically get, a psychology license. It's because they hold that accreditation. And so we evaluate those individuals, and we do struggle with people who want us to approve their programs. And we say, well, we don't know, we don't understand how the program was created or how it changes year to year, or, you know, even what, potentially courses are kind of changed. And so we're reluctant to kind of weigh into that with educational institutions.
Thanks for sharing that. And I think um, that kind of leads into next, focusing on exploring a mechanism that some professions and jurisdictions such as yours already use from your review processes, which is recognizing graduation from a board approved, or in this case, more board recognized accredited program as evidence that educational requirements have been met. So we can explore how it's already used in that context and what we can learn from those examples. And I think, Sam, that your board provides a particularly useful example because you've experienced firsthand the difference between reviewing applicants from accredited programs and reviewing applicants whose educational preparation requires a more individualized evaluation. So to start, I think it could be helpful for everyone to understand, how accreditation fits in your board review process. So could you share how does your board use programmatic accreditation when evaluating whether applicants have met the educational requirements and how that differs for applicants from accredited
Mhm.
and non-accredited programs?
Yeah. So first, I'll just say the accrediting body that the board recognizes is APA, so the American Psychological Association. They have a committee on accreditation um, that recognizes programs or accredits programs. And they're all at the doctoral level degree, in psychology. So our standards in the state are you have to have a licensed doctoral degree. Sorry, you have to have a doctoral degree in psychology in order to be eligible for license. Um, and then we also say elsewhere in our rules that somebody who graduates from an APA accredited program meets those standards. And part of that is that APA tracks their accreditation to this job task analysis for the profession. So they're making sure that they're hitting all of those high points. Um, and so um, when we see somebody who comes from an APA accredited program, we know that they've gone through a program that looked at the job task analysis and that their program has said, we believe, that they're competent to do the work that's contained in that. Um, and so in my board, we have two pathways. We have a pathway for accredited folks, for people who graduate from an accredited program, and we have a pathway for people who graduate from programs that are not accredited. We're open to those. We still license those individuals. Um, but for accredited folks, or for people from an accredited program, we have been delegated authority by a board to we're delegated authority to actually just approve them as staff, right? Because I'm not a psychologist, I'm a lawyer by education and training. Um, and I don't have a psychologist on staff. The psychologists are on my board. And so I wouldn't know, whether somebody's course you know, in like lifespan development would meet the requirement. I wouldn't be able to look at several different courses and say like, oh, this meets the lifespan development course we require as part of our licensing requirements. So, but I know that APA would. And so if they come from an APA accredited program, we can just approve them to sit for the exam right away. If they can't be, if they don't come from an accredited program, then we have to have them map their coursework to our requirements. Um, and then I have to have my psychologist look at them, my board members. And so we have a committee called the Application Review Committee. It's three psychologists, and they look at the transcripts and the course descriptions of all of the courses that somebody's taken, and we ask the applicant to map it for us. Where do you have lifespan development? Where do you have ethics and psychology? Where do you have um, psychopharmacology, things like that are required for the profession. And so we will have them do that. And the way that we do that is in an open meeting where they talk collectively about it. And those three board members decide it meets, it doesn't meet. This, 7 of the 9 areas meet. And so, some of the data that we have is that on average it takes us from the time of application to the time that we approve a person for the EPPP, which is the exam, about 35 days for APA accredited program graduates. Um, and for non-APA accredited program graduates, it takes 101 days. So that's a significant amount of time where people are not working at the top of their license because they still have to remain under supervision during that time.
I think it's, yeah, an important point to make in that, there's an individual waiting, in this process
Mhm.
time, waiting for a decision. So I
Mhm.
think that waiting time is important context to share. Um, how, when it comes to like your staff,
Mhm.
in terms of thinking about the licensing board impact, you mentioned the different process, but what differences do you see in like staff workload, or you mentioned processing time, but
Mhm.
what, and I guess I would also say too, like, what are other responsibilities that you're able to attend more when you have less processing time for certain programs? I think that context might help
Yeah.
people to kind of understand.
Sure. So for instance, for the APA accredited program graduates, we're not looking at their underlying coursework in our state. Our state is um, APA meets requirements. So if they come from an APA accredited program, we just approve them and move them on. For people who from non-APA accredited programs, applicants, we have, I believe it's 9 content areas. And they will submit courses and say, I want, here's my transcript that we get from the institution. So we're waiting on documents from them. And then the applicant has to go back to their institution and get the transcript and then also get the course catalog and all of their course descriptions because it's not just enough for us to review that it says that it's a lifespan development course. We have to see what the readings were. We want to see, kind of what the topics of the course were, tests and measurements. We want to make sure that there's both tests and measurements. And so it creates a lot of work for my staff to look at all of that and get it all lined up because my staff collect the documents, write up the report about where each document can be found and whether we've approved it before in the past, and then has that all packaged up for my board members to review. Because my board members aren't employees of the board; they're just professionals that are committed to making sure that the profession is well regulated. And then they have to spend time reviewing those applications in order to make a determination about whether they meet the educational requirements. And so there's a significant amount of time doing that. This last year, eight, we approved eight non-APA accredited applicants, and two of them required additional rounds of coming back to the committee. And when they have to come back to the committee, because they don't meet requirements at first, they have to wait a month for our next meeting because that's when we meet. Um, so, I mean, it does cause, a lot of time for staff. Staff could be doing, quicker background checks, quicker supervision verifications. Because remember that education is only one piece of what we're looking at here. A lot of what my staff do is related to the supervision that certified graduates actually, are doing in the field right now.
So I think, listening to that experience, it does sound like accreditation, does serve an important role in helping your board evaluate educational preparation. Saves staff time in certain ways, making parts of the process a little more efficient. But what could you say, from your experience, what does that suggest about the role that accreditation can play as a recognized indicator that educational requirements have been met?
So, I mean, I think that when you have that specialized accreditation, so it's just really easy for the boards to say like, oh, we're dealing with somebody that meets the requirements or more than likely meets the requirements, right? We don't. So I said we have the three different aspects um, that we're looking at. And so this is specialized accreditation, nothing to do with like the regional accreditation or, the accreditation to provide services in Minnesota, just like for psychology, for the APA programs. That we know that this individual is probably trained to meet the requirements that we're looking for someone to meet in this state. And so we don't have to focus so much on that. We can focus more on, test supports for them or testing for them. Um, or we can look more at the field work, and we can move those individuals through because really, our goal is to license as many qualified people as is possible in the state of Minnesota. We talk about the mental health care crisis a lot. We talk about reducing barriers a lot, and how can we get people to be practicing at the top of their license, um, and practicing independently. Because for psychologists, until you become licensed, you need to be supervised. And if you're being supervised, then that's an hour of services or hours of services that supervisor isn't seeing other clients or isn't seeing other people who need that supervision. So the faster we can get people from the point of application to full licensure, the better off we are because those people are then, able to fill a need in our communities and provide the services that Minnesotans need.
I think that's a great point, and thank you for sharing because I think it really shows how efficient processes can really, or inefficient, or however you want to frame it, just all the trickle down impacts of, being able to improve processes in some ways. And so I think that kind of raises the question of like if we can see some benefits in that in some places, are there other examples, for other boards or other professions? And so I was wondering, Chris or Emily, either one of you, do you have any other examples where you've seen accreditation being used, more effectively as kind of part of a licensure decision?
Yeah, I've got a couple of examples. So one of them's pretty well known, social work. There's the Council for Social Work Education, CSWE, really across the board for all states and territories that have a master's level social work license. You need to complete a CSWE accredited program, period, for the educational requirement piece. Again, exam separate from that, there could be experience requirements, but just the education. The one kind of caveat there is the states that have clinical level social work licenses. Some states do look at transcripts for particular courses, like for example, a course in psychopharmacology or something like that. So that's one small exception, but different level license. That's the clinical level license. For the master's level license across the board, it's CSWE. Another one that's a little bit different is athletic training. So really, most all of the states and territories that issue athletic trainer licenses are lined up behind CAATE for the programmatic or specialized accreditor. There are a few states that kind of have their own nuance going on still. Illinois comes to mind. I think Texas might be in that boat too. But even in those cases, with Illinois and Texas, they are going to recognize that accreditation as at least fulfilling in part or mostly all of their educational requirement expectations. So those were a couple examples. And again, it's really, I think, quite uniform at this point, where for all of these licensed professions, there's some sort of programmatic or specialized accreditor that's being recognized, at least by a percentage of states that are licensing. And I don't know that if it's right to interject this here, Catherine, but I'm going to anyway. Sorry if I derail us. But I just wanted to address what might be an elephant in the room, because for those of you on this webinar today from institutions, you might be thinking, well, that's all well and great, except it's a lot of work for us and a lot of money for us to get programmatic accreditation or specialized accreditation of these programs. That is true. It is a tremendous effort on behalf of institutions, both with your time and money invested in these programmatic and specialized accreditors. But I think, kind of back to Sam's point of how much time and efficiency it can save on the licensing board end of things. If as an institution, I'm able to go after that programmatic accreditation and achieve it and know that my graduate is now going to meet the education requirements in virtually all states around the country, maybe that's a good trade-off. So again, we can get more into that. And I know that there are certain programmatic accreditors that are implementing barriers for specific types of institutions sometimes. And so we can talk about that if people want to too, but I don't want to derail us anymore.
I think those are great, and I think that we could definitely get into that into the Q&A some more. So maybe jot that down to bring that up a little bit more detail. Um, but Emily, I do think that educator prep is another kind of compelling example in terms of how jurisdictions can recognize the different types of accreditation there. So from that educator preparation perspective, could you talk about how, and I'm not sure how to, if there's a brief way of saying CAEP or AAQEP, other types of accreditation, and how they already function in practice when states evaluate whether educational requirements have been met?
Yeah, it's pronounced CAPE and AQUEP. We all
Yep.
love our acronyms.
Yes, we do.
Um, and in educator preparation, I'm going to provide sort of the opposite examples that Chris and Sam have, because in most cases, in most states and educator license types, the CAPE and AQUEP accreditation does not fully meet educational requirements. Um, and so candidates are still going through individual review. States may still be looking for that accreditation and may accept it for some pieces. I think, as Chris was saying, They'll still look for specific courses like, for example, Alaska accepts CAPE accredited programs, but for several of their license types, they are still going to do a transcript review and look for specific reading coursework. So it's still, work on the side of the agency. Um, like Chris said, it's such a significant lift for institutions. And in ed prep, you're looking for the accreditation as well as state approval. And so those are two big pieces that are really on parallel tracks that institutions have to navigate both. Um, and unfortunately, for ed prep, you still need both. Um, the state approval in your home state, and then meeting those specific requirements in the other state, and then possibly accreditation.
Yeah, thank you for sharing that. I would also be just interested in your perspective as someone, working closely with programs or having that type of in-depth research knowledge that you have. How does greater or how would, greater consistency in recognizing accredited programs affect graduates who may, relocate or pursue opportunities across state lines or just being able to, respond to workforce needs in different regions?
Yeah, I mean, it has the potential of increasing portability. Um, if boards were set up like Sam's, where it could take 35 days if someone is coming in with an accredited program, um, that clears the path so much better. And there are so many understaffed and vacant teaching positions in the US. I think the last report from the National Center for Ed Statistics was 69% of public schools are understaffed, which is crazy and so sad for our kids. And so, if there was a pathway for these uh, quality teachers to get a license, there is the chance that it could really impact the workforce and our kids out there. Um, And I will say, I really liked when Sam said competency drift. And then I think Erica mentioned in the comments, again, accreditation is also not a one-time thing. So it is a continual review on a cycle, self-studies looking at data. And so accreditation is a measure of continually meeting those competencies. So, accreditation is, if it's accepted for licensure, in my opinion, it's not lowering the bar. It's more like agreeing on which bar counts.
I think that's a good takeaway, and I think it, segues nicely into kind of looking at what would it take to move toward that, because, expanding recognition or reliance on accreditation is obviously not as, simple as just deciding to do it. There's going to be a lot of statutory or operational or other types of considerations that can shape what boards can realistically adopt or want to adopt. Um, so, Chris, I thought I'd start with you here, just kind of discussing some of these more practical realities. From your experience, what would need to happen for accreditation to be recognized more consistently across jurisdictions or professions? And, Sam or Emily, feel free to, add on as well.
Yeah, I mean, I think you just touched on it, Catherine, right? But we're talking about a fundamental change in state law in order to make this happen. So a state would need to adopt the programmatic or specialized accreditation as being recognized in that state through the legislature, most likely. Maybe there's some rare exceptions where it could just be a border agency rule or regulation change. But I think we're probably looking at a legislative effort here for the most part. And then the other piece to that is, we often find that specific programmatic or specialized accreditors are not named in the statute itself. So, it's not being named by the legislature, but the legislature is just giving the authority to that licensing board or agency to recognize a specific programmatic accreditor. So it's going to be a two-step process, probably in most instances, where the legislature gives the board or the agency the authority to recognize a specialized or programmatic accreditor as meeting all their educational standards. And then the board or agency has to go through their rulemaking process to decide which programmatic accreditor or creditors they are going to recognize. So that's kind of the practical piece from the legal standpoint. And then it's not easy ever, I think, to get legislation through most states these days. So the practicalities of that are you're going to need to have the support from the profession itself, right? So if we're talking about a state adopting APA, we'll use psychology as an example. If they don't currently recognize APA as a programmatic accreditor for meeting the educational standards, you for sure would need to have that state psychological association on board with the effort, just to get the legislation through, and to get it passed. And of course, other stakeholders are going to care as well, including you all as institutions are going to have a stake in that. In particular, if you have a program that's not APA and your state is trying to move in that direction, a big impact. So I think that's kind of the mechanics of that. I'll let Sam, if he wants to talk about any of the kind of more like process pieces or impact to the state board or agency, because I'm sure there are many that would come from that.
Yeah, I mean, I guess part of the standoff, I think a little bit in this piece is that like I don't feel like I'm competent to judge programs, right? Like I don't feel like that's not what my board was created to do or what we're supposed to be doing. And so I realistically get why we are reluctant to weigh in on that sort of stuff. It's really, we try very hard to stay in our lane, to do the things that we're good at. And evaluating, an educational program, even for my small board, is just probably not what we would consider to be within our scope of what we are competent at doing. I don't know that's I feel like that's not super helpful, but it is the reality of where we're at. And if the legislature told us we had to do it, which is I think would be what would be required, Chris, I think you're right, for the most part. We do the work, but it would take quite a bit of change with respect to how we operate, and that would be multiplied many times over the different various professions in terms of how we or operationalize that work.
Mm-hmm.
And that's reflect. I think there's one other important point. In Minnesota, at least, we're a self-funded agency, so we don't get any state revenues. We collect all of the money that I have to collect every dollar that I spend from our licensees, and I get that from licensing fees. And so one of the other pieces that you have to contemplate as we unravel this problem is that as if that is a solution where I have to try and figure out how I'm going to approve educational institutions in addition to applicants, um, if I have that increased expense, then I have to have that increased revenue. And I get that increased revenue by raising licensing fees on my licensees.
Mm-hmm. And I think you both brought up good points from the standpoint of, statutoral changes that would be complicated, board changes that would be complicated. But whenever changes to licensure systems are discussed, there are a lot of concerns that might be raised, especially, we've been to conferences where we've heard concerns from, boards or practitioners or policymakers about relying just on accreditation or more heavily on accreditation. So, Chris, or I welcome anyone to, share, but just starting with you, what questions or concerns, do you hear policymakers bringing up when the point about possibly relying more heavily on accreditation in terms of that educational quality indicator? What are the concerns in doing that,
Yeah, I
generally
mean,
speaking?
Yeah, I think many of these concerns probably are in line with concerns that were brought up in a recent federal negotiated rulemaking around accreditors and accreditation, right, and what their role is. But I think it's the primary one is always, we're not going to delegate our authority, right? So if the state is relying on this external third party as the standard, well, essentially they're delegating their ability and authority to set those educational standards to that third party. And they really have no control over that third party, right? So the state of Minnesota has no control over what American Psychological Association decides to do with their standards or their requirements for accreditation. So that's always the primary concern there, which, I think is a valid one because that practically is happening, that you're giving up some of your ability and authority as a state to have that bit of oversight. But the other piece too is again kind of maybe related to that discussion at the federal level is, who are the accreditors and how are they setting their standards and kind of what are their own internal processes and mechanisms for governance, and do we trust them? I think is kind of the ultimate question that might come up in some states. So if there's any kind of questions around mismatch potentially in values or alignments or what the standards are teaching to or not teaching to or who's included in certain things, I think all of those would come into play if would see a legislative effort in any given state. Of course, that's going to depend on the political makeup of the legislature in that state, and kind of who has the loudest voices and speaks to those things.
And Sam, I'd like to come back to the board perspective for a moment. Um, I think that there are obviously, legitimate reasons that boards are going to need some flexibility, regardless of what the system is. So, can you share like where you see that boards might still need some ability to conduct more individualized review, even when accreditation, an applicant is from an accredited program?
Sure. I mean, I think that it's reasonable that part of the reason that you create boards is you put together groups of experts who understand the field better than a legislator could, um, better than that knows what the practice of in my profession, psychology, the profession that I regulate, knows the practice of psychology better than people do at 20,000 feet. They're in the weeds on this. And so there might be places where the people are seeing where we're seeing an issue in the field, and we're kind of lagging indicators on some of that. So we might be seeing issues in the field and realize, oh, psychologists are doing this type of work, and we don't have any visibility as to whether they're competent to do that type of work. And because they're doing that, we better check to make sure that they're competent to do that by the coursework that they have. And so we might have to do some individual, it just keeps us able to be proactive about how we evaluate applicants should we need to use it. And I get that psychologists in North Carolina believe that psychologists in North Carolina knows what's best for the people of North Carolina because they're closest to that situation. I mean, I understand that, and why they might feel that way and why they might make evaluations from that perspective because they feel like they have their thumb on the pulse of what's going on in their state.
Mhm.
It's not the approach that the Minnesota Board of Psychology has taken. And to be clear, I don't know if that's the approach that the North Carolina Board has taken. I don't keep up on these things as much as I used to, but I mean, I get why states might say, I want to keep these evaluations for myself because I know what we need in this state.
Mhm. So we've covered a lot to this point from, institutional workload and student mobility to licensing board review processes and examples of accreditation being used as part of educational recognition processes. Um, we'll shortly get to audience Q&A. There was one question in registration that I wanted to, save right before the audience Q&A. And that's a topic that kind of frequently emerges in these conversations is the relationship between educational recognition and interstate mobility efforts. So Sam, we'll start with you, but Emily or Chris or Sarah, if you have anything to add, please feel free. How do interstate compacts and other reciprocity initiatives fit into this broader conversation about licensure portability and educational recognition?
Yeah. So I'll just say Minnesota we're a part of SIPACT, which is the Psychology Interjurisdictional Compact. We have 44 states that are participants, and 43 of them are active right now. Um, and so this is about as broad-based as compacts get. Um, and they're wonderful. Because it does allow portability. It does allow for people to practice into jurisdictions and for me to feel comfortable that they've been vetted. Um, and it allows for mostly it allows for like continuity of care. right? So we have somebody who moves from Wisconsin to Minnesota, and they want to see their same psychologist. Well, at the psychology, PsyPact is a telehealth, so that person can stay in Wisconsin and still continue to see them, their client in a telehealth environment. And we don't have to be involved in taking money from that individual or even really doing too much unless we get a complaint about them. Um, and so it does help with the flow of workforce, from one state to another, at least in terms of teletherapy. Um, and then I think the other piece um, is that it allows, like, for instance, a student who's, going home for the summer to continue to see a psychologist that they have here in Minnesota that goes home to New Jersey or to Maine or whatever, to continue to see that person across the summer, which again, that continuity of care is super important for our consumers of healthcare service. Um, any kind of compacts, yeah, I think I've been a big proponent of compacts, and we supported the bill that moved us into SIPACT, and we've seen benefits to it. We see about 350 more providers than we would have had, because people might not pay the licensing fee to get licensed here just to see one client. But they might, decide to provide services into here for 3 or 4 or 10 people that they're seeing here in Minnesota. Because there's that kind of economic cost benefit analysis that all psychologists are doing. If I have to apply for licensing in Minnesota, how many clients do I need to be seeing regularly to make it worth my while? And SIPACT lowers that barrier because they can opt in to seeing in different states. Um, Other compacts have different models. So some of them have like privilege models where it's just like fast track to license in that state. There's several of those here in Minnesota. I think the medical compact is that way, I believe. Um, and so there are different types of compacts, but I think generally anything that helps people kind of triage services to where they're needed is a really important tool that the licensing boards have in terms of providing access to care, which is part of our mission as well.
Hmm.
Yeah, and if I can just jump in and add quick, Catherine. So I think that everything Sam was saying about access to care and continuity of care is really important to keep in mind when you're thinking about compacts, because in general, compacts are there to facilitate people that are already licensed and practicing to be able to do so in another state or territory, right? So I think the question was kind of referencing back to, well, how does this relate to understanding if our programs meet educational requirements? And you really have to be
Oh,
cautious
good
here
point.
because, yeah. So I'm going to put words in your mouth, Sam. But what Sam didn't say is, hey, we rely on SIPACT, and that lets us know that the educational requirements are met. No, but SIPACT is completely separate. His office, his staff, his board still has to do that review of the educational requirements for someone from a graduate of a non-APA program. Even if they come from a state that participates in SIPACT, it doesn't
Yep.
matter.
Right.
So different things, and that's the same really in other profession compacts as well. One big exception is the NASDAQ Interstate Agreement for Educator Reciprocity. I'll just say that, and if people have questions, I'll let Emily field those.
Well, I think from an institutional perspective, what I've found is that the compact issue makes it very confusing for academic programs because they absolutely do not understand why, if we're in a compact, that we have to still worry about this. And I guess one question would be, what's the best way to educate your faculty and your departments to help them understand? I mean, I know the answer that I've heard anyway is that, as you alluded to, Chris, that's post graduation. And so this really doesn't have anything to do with that. It may inform whether your program might meet requirements, but I don't know that it does. So I think it would be helpful to know how institutions are helping to educate their academic programs about why this is not the golden ticket. to being approved.
Yeah, I wish I had a really like succinct answer, Sarah, to give you that just say these magic words and then
Yeah.
your program will understand. But I think unfortunately it is just trying to continue to educate that, compacts are focused on licensed professionals generally. And so that's all happening way after they leave us, right? That's outside of the program. And I think I saw Cheryl put in the chat here too, states are participating in the licensure compacts. It has nothing to do with individual institutions.
Yep.
Sure, your state may participate in it, but again, there's no kind of direct connection into your educational program when it comes to the compacts.
I think the institutions, again, the academic departments don't see it that way, but I understand that, but they don't see it that way. So I think, maybe those of us who are in these kind of positions, maybe we need to understand some of that better so that we know how to respond better. And maybe these are some good resources to read to know how to explain that.
Oh, perfect. I think that we can open it up now for audience questions and other broader discussion. I think there's a couple in the Q&A. Cheryl, were you going to read those or would you like me to? I think I see
Sorry, I was
one.
typing at the same time.
Sorry.
So, because that's a lot of, what you all have addressed here is the question we've been talking about for about 6 years about portability of education versus portability of license. And, those are very big differences. So anyway, okay. I think this first question is for Sam, please. So from the licensing board's perspective, so from your lens, has the implementation and various updates to, and this is related to the disclosure situation, 668.43A5 Romanet 5 refers to the public disclosures, increased any burden on your part? And if so, how have you addressed that burden? I guess that would be in regard to communications and support from institutions in regard to providing disclosures.
That's super interesting because we have not had, I would be the person that would hear these questions for the most part. And we haven't had a lot of outreach, from institutions. Although I will make one extremely large caveat, and that is that by and large, we have, APA is fairly prominent across the states. I think almost every state recognizes APA accreditation as an expedited to some degree pathway to licensing. And the second caveat is that the largest two programs that would have graduates from non-APA accredited programs are both housed here in Minnesota. So those programs would normally be asking other states, but they actually have to already meet our requirements in order to provide those
Great, thank
programs
you.
here. Yeah. So yeah.
Yep. Yeah, thank you. So what's interesting is that, we do hear that there have been some that have addressed NCSBN and NASDAQ
Mm.
that they're getting these phone calls.
Mhm.
And they are trying to they don't know what to do with them. But the burden has been trying to accept the phone calls, or the emails, but not necessarily that they've changed their practices other than NCSBN has really tried to help their states put their rules more prominently. So anyway, that's very interesting. Thank you, Sam. Appreciate that.
Mhm.
And so this is the $1 million question. So if institutions are encouraged to reach out to state licensing boards, we talk about that,
Mhm.
to determine if the program meets licensure requirements or certification requirements. But understandably, boards are reluctant to provide approval, much like Sam said, that's not their role. What is the way forward? How do we try to address that? What's the suggestion? And then we all win $1 million, right?
Right.
Well, it's
Well,
interesting because it would have been nice, like at the federal level, if we'd have been consulted about some of this stuff.
1,000%.
yeah.
Right? Because I'm probably more I probably have more knowledge about the interstate play than the average executive director because of my roles at Capella and Walden, and working with the licensing teams there and also, the regulatory teams that would do more state authorizations to provide those, courses or programs there. And it's even confusing for me how this would be set up. And it would have been nice for for us to be able to provide some input about what we think we can and can't do, with respect to answering some of these questions, because I think some understanding of that would have been, um, helpful and maybe not made quite as much work for everybody. I mean, obviously this work needs to be done. Some of it is whether it's done at the licensing board or whether it's done at the educational institution. And a little bit we're in a kind of staring competition about who's best positioned to do it.
That makes so much sense, Sam. Chris and I have talked about this before, and it sort of makes sense that this should be a requirement, but at the same time, with professions and states being so different, had there been collaboration, had there been discussions, maybe there could have been some sort of consumer protection rules that were developed that were more applicable to the structures that are in place.
Mhm.
Well,
Yeah.
that's all of the questions, Catherine, that we have, unless somebody would like to add some more questions here. These were good questions.
They were, and I do want to add on to what Sam mentioned in terms of being consulted, because we presented at a conference of professional regulators, and to get to, I believe it was Bill's question about the burden. I don't have the exact data in front of me, but I do remember asking those board representatives if they have seen an increase in communications, and I remember the majority had said yes, mostly in the realm of, does my program meet educational requirements, or what are the clinical or program approval requirements? But I think importantly, one thing I was able to, kind of find while people were talking that kind of echoes what was talked about earlier. We also asked them, what barriers that the board faces in terms of responding to institutional inquiries, which I think is reflected a lot what we talked about today. Liability concerns or legal limits in giving binding answers got the most amount of responses, followed by the complexity of program by program reviews, which Sam mentioned, and then limited staff was the three highest responses there. So I just thought I would provide a little bit of that extra insight, from a room of board representatives that we had who kind of shared a little bit of the impact on them as well. But if I don't see any other questions from the chat, I do just have, as we wrap up, just one kind of final takeaway, question for our panelists. We've talked about complexity, mobility, public protection, practical implementation. So, if participants remember only one thing from today's discussion, from your perspective, what would you want it to be? And Sam, we can start with you.
Oh, actually, could I?
Yes, you can wait. Look, you can
I want to
pass. We'll come
think.
back. You want to think a
Yeah.
little bit? Does anyone feel comfortable starting off?
I can start. So I think one takeaway I'd want everyone to walk away with today is just, you know, this is absolutely complex work. And by that I mean, licensure overall, but especially the work that we have to do as institutions, to decide if our programs meet the education requirements or not. So it is complex work. Just keep that in mind as you're trying to build your support at your institution, build your processes, and if you need help getting that message across to your leaders who might not understand this, then rely on the resources that SAN has created through the special interest teams and other avenues. You can also rely on things that Help puts out, that it is extremely complex and extremely important work for your institution and for your students.
Yeah, I'll add on to that. It is very complex, and for institutions, I think it's really important to know that accreditation, having that accepted as educational requirements, is not a magic wand. There is not going to be one to improve mobility, but it's there's a possibility that it's a good tool in the toolbox.
Yeah, and I would just say that just when you're dealing, I guess from my perspective, when you're dealing with licensing boards, understand that um, they're bound by rules and statutes to do the things that the legislature tells them to do. Um, and it's not that they're it's not that when I don't answer a question, it's not because I feel like I want to be difficult or I don't want to answer someone's question. It's because I don't have a good way of actually providing that answer, or I don't feel qualified to provide that answer. And so it's hard for me to say, this is what you need to do when it's really not like I don't have any authority to try and tell you to do that. And I'm trying to be respectful of that by recognizing my limits of authority and not trying to tell you what to do when it's not really, something that I should be doing. And so, accreditation is always in our state, always the easiest way for people to kind of look and get licensed in terms of the health professions, but it is a complicated thing. Yeah.
I guess coming from the institutional perspective, you know, I think that what we're doing right now is the takeaway I have is that it's so important for people who are doing this work, I guess in my seat, to continue to educate ourselves because I learn sometimes like it's really important to hear from somebody on a licensing board to understand that limitation of authority. And
Mhm.
I don't know that I really understood that before. I mean, I know that there have been deciding we're not going to do this for other reasons, but I've not really understood that limitation of authority. And so I think if there's anything that I would want to say is that we just those of us who are in these positions is to continue to educate ourselves and really participate in these kinds of events because um, it's well worth it. So thank you to San for pulling this together.
Well, and thank you all again for having such a thoughtful discussion and sharing all these perspectives. I'm always very pleased when I also get new insights, so thank you all for that. I need to make some notes to follow up on other things. And I just think one of the key themes, that emerged is that, what we talked about is very complex. And although there are certainly no one size fits all solutions, I think the conversation highlighted examples where accreditation-based, educational recognition can help, and in some cases already is helping reduce workload and review burden while also preserving the public protection responsibilities that licensing boards are charged with maintaining. We have some resources here. We've put some resources in the chat, throughout the time today. If we go to the next slide, you'll see SAN's contact information. Always feel free to reach out to a member of the SAN team with any questions, or if you want to get in contact with any of today's guests, we'd be happy to connect you all. And of course, if you think of any other questions, please reach out and let us know. We'd be happy to share any thoughts or answers that we can find. Thank you again to our panelists and to everyone who joined us today. We hope that you'll join us tomorrow for the next session in SAN's summer webinar series and continue to come to these conversations and, share more and learn from each other. Thank you all.
Thank you.
Take care.
Thank you.
Leah, you can stop recording, please.